Hi guys, hope you're well. Welcome to day 11 of the Arora AKT 30-day challenge. Hopefully you enjoyed the first 10 days. Now we're starting the second of our 3/3, as it were, and probably the pressure is starting to build a little bit if we're doing the exam in the next 20 days or so. Hopefully, like I said, you've got some benefit out of the first 10. And now I'm sure you started to do some preparation and you're well on your way to achieving a really good score in AKT. So today is another clinical question again. So with clinical, it's important to look at the knowledge. So do you know the current guidelines? Do you understand what's needed from the knowledge point of view? But also, can you look past just pure knowledge and look at technique as well? And try and make sure you can buy a couple of extra marks, even though you may not exactly know the full extent of a guideline, for example, or when you're down to two answers and you're not quite sure which one it is, knowledge may not take you beyond a certain point, and how can technique edge things ahead. So we're going to look at all those kind of things as we do and as we have done in the previous 10 questions. So I'm going to go silent, switch the screen, have a look at what you got, let me know your thoughts as to what the answer was or whether you got it right or wrong, and we'll come back on the other side of 57 seconds and look at the right answer and the knowledge and sort of technique component as well. Let's go. There's time, guys. 57 seconds. Now, some clinical questions, as you know, you can answer very, very quickly because you're looking for one word in the answer. They're just all answers are one word, really quick to read. Some you have to think a little about because they're all statements and you have to work out whether statements are correct or not, and it can get a bit more challenging. So if you didn't quite get this type of question in 57 seconds, it's okay, because these are the kind of ones that you might take a little bit longer on in the exam, and it will all average out hopefully by the end. So you see a 42-year-old female with a 2-day history of a swollen red left calf. Now, of course, you've got to be thinking about DVT, but the title on the YouTube thumbnail says DVT, so you kind of get what that is. Which of the below management options will be most appropriate as per NICE CKS guidelines? And it's really important to remember that the guidance you're looking at here is NICE CKS, i.e. primary care based, because a lot of you guys doing AKT and you might be in hospital, and how you handle a suspected DVT in hospital might be different to primary care, and you've got to be kind of switching into that primary care zone when you do the type of exam. So as per NICE CKS, which is the most appropriate, so the true answer, basically you can change most appropriate to true just to make it easier in your mind, and the only true option here is C, prescribe rivaroxaban as interim anticoagulation if indicated. So that would be a true statement as per the guidance. That's one of the first line medications that you'd use for interim anticoagulation. The guidance changed fairly recently, so it's worth reviewing that. All of the statements are false or not true, and we'll go why and come back in a second as to looking why. But very briefly, a D-dimer shouldn't be arranged in all situations. Again, all patients with a proven DVT don't need to be investigated for underlying cancer. The all is key there. If proven DVT should be in a minimum of 6 months, that's false, it's 3. And a PE well score of 3 would suggest the need for admission. So a lot of you guys might have put E, but you might have just overread the PE part here. So your brain wants to think DVT well score, so you might read a well score of 3. And if it was a DVT well score of 3, then that's true, but it's not. It's a PE well score, so that's false. The only true statement is C. So let's go through some key stuff on DVT that will come back to the question and look at how, apart from the knowledge, how could the technique have helped you there, even if you weren't quite sure of the guidance. So DVT, of course, a clot in the deep veins, usually in the leg, but can get in other parts as well. The classic presentation that you'll pick up, no doubt, in a question: swelling, redness, tenderness, pain behind the calf or the thigh or wherever the deep vein clot is. A lot of risk factors, as you guys know, that you'll hopefully think about in a question, but hopefully hopefully you won't need those risk factors to know something is DVT, but these things are always there. just to help you kind of trigger it initially in your mind. So previous history of VTE, that could be DVT or PE, use of the combined oral contraceptive pill, recent history of long flights, recent history of cancer, immobility, smoking history, increasing age, obesity. There's quite a few others as well, but hopefully they should stand out. Now, what does the NICE CKS guidance say then? So if a patient comes with suspected DVT, what we should be doing first, if possible, is a 2-level DVT well score. And with the DVT well score, remember this is different to a PE well score. A DVT is likely if the score is 2 or more. So anything 2 or more is high likelihood or likely. Anything of 0 or 1 would be unlikely DVT. Now, if someone has a likely DVT, the guidance suggests that we should be getting them ultrasound scanned within 4 hours. But if it's not possible to get an ultrasound scan within 4 hours, that's when you arrange a D-dimer. You may need to start anticoagulation and get a scan done at least within 24 hours. So ideally you want to scan within 4 hours. If you can't, get a D-dimer and start the anticoagulation and get a scan arranged within at least 24 hours. If a well score shows that they have an unlikely DVT, i.e. score of 0 or 1, then you check the D-dimer at that point. And if the D-dimer is raised, again, it goes back up to get a scan within 4 hours. And if a scan is not possible, then it goes back to anticoagulation and get a scan within 24 hours. So the key thing is get a well score done. If it's 2 or more, they need an ultrasound scan within 4 hours. If it's 0 or 1, you get a D-dimer. So the answer there, which said all patients need a D-dimer, or the next step will be a D-dimer, was an incorrect statement. Now, if interim anticoagulation is needed, then first line as per NICE CKS is apixaban or rivaroxaban. So the statement C there suggesting that prescribe rivaroxaban as interim anticoagulation if indicated would be an appropriate statement as per NICE CKS. This used to be different, so this has changed. If someone has a proven DVT, then they'll need anticoagulation going forward for at least 3 months, not 6 months. No travel for at least 2 weeks if you have a proven DVT. And if there's a history of unprovoked DVT, so we're not sure why it's happened, out the blue, not expected, then you'd be thinking about doing to screen for underlying cancer or things like thrombophilia and the various causes that can lead to that. So it's not in all cases, it's just when it's unprovoked and you think there's something there that you need to be looking into. But the key takeaway there is the well score. So if we go back to the options then, so why is A false? Like we said, a D-dimer should be arranged at this point. That's incorrect. It should be a well score if you're seeing somebody. B, all patients with proven DVT should be investigated for underlying cancer. Even if you didn't know whether that was the guidance or not, the word all there, like we talked about in previous videos, is a very 100%er, isn't it? A very hard word. And that should automatically be putting flags on your mind to say it's unlikely that all patients need exactly the same thing every single time. C, like we said, rivaroxaban is one of the options for interim anticoagulation. D, if proven DVT, you need a minimum of 6 months, like we mentioned, it should be 3 months. And then E, let me know if this got you, by the way. Let me know if you missed that word PE. A PE well score of 3 would suggest the need for admission. So the score of 3 is correct. Admission for ultrasound scan, that is, but it's the PE well score that changes that. A PE well score is very different. We've got a video on YouTube. Have a look at the difference between PE well score and DVT well score, and it should clarify that down up for you. But really hope this helps. Really hope you've picked up those key points in terms of what you should be knowing from a DVT point of view. A quick reminder about our flashcards. DVT well scoring guidance for both suspected PE and DVT are both covered as one of the cards in this deck. A lot of you guys bought this on the last time we put this on our previous video, so I hope you're finding it of some value. Make sure you use the coupon Arora video 10 for 10% off any AKT resource that we have, not just the flashcards. But these, you've still got a bit of time, 20 odd days to go. We post them the next day, so they should be with you in a couple of days time, but they're just good for reference, quick looking at guidelines, all those kind of long CKS guidelines that take you forever to read, or if you have guidance amongst various different places, online courses and mock exams and question banks, this just kind of puts them into a nice little compact deck. Again, let me see if I can just show you the DVT one. So as you can see, there's a little deck here that you slide out, and it's got a contents on the front. Where's DVT? Deep brain thrombosis number 20. So this is the DVT card. You can see, similar to what I've just taught you right now, really. So risk factors, the 2-level well score, what to do if likely, what to do if unlikely. It's updated. You can see it says apixaban or rivaroxaban. That's changed fairly recently. and the indications about long-term treatment as well. So that's an example of one of the cards. Hopefully you can have a look at that and see if we can add value to your AKT preparation. Hopefully this has been good. We will see you tomorrow for day 12 for another clinical question. In the meantime, give me a shout or contact me with any other queries that you have. Please do comment down below to say whether you're finding these videos of use or of value, or if there's any areas that you want me to cover, whether it's Facebook or YouTube or LinkedIn or Twitter or Instagram or wherever you're watching this video. But I really do hope it's given some value to you. Hopefully we'll see you tomorrow. Have a good day. Hashtag #CanPassWellPass. Hashtag I went with Arora.